so I think it's been 9 months. I was looking at your file since we talked. It's been 9 months. I know you were like, hey, I gotta get through some stuff, figure this out, and then go from there. And then you did the document for me. Let me share that together, and then I can make sure we can answer questions. And I have some things to consider as a new strategy of what we may want to do. Okay.
Oh, sweet. Great.
So, so last time we talked, I mean, the focus was really to make sure you don't fatigue your frontal lobe with your daily activities, and then we wanted to see if you can get into autophagy and do some fasting and go through that whole procedure, right?
Yes.
Our first follow up, like, it didn't seem like that was working that great for you, and
Hmm.
since your last one, which registration protocol have you followed? Let's just go through. I've followed the protocol of finding patterns that exceed my frontal metabolic rate and made changes necessary. What were they for you? What were the things that were really fatiguing you?
Yeah, a lot of it was work related. So I had pretty good amount of projects at the time and didn't have to have them. So really that was a big portion of it is just cutting off a lot of workload. So
Okay.
mhm.
What have you noticed with that? Has it been significant or just minor?
Some of the, so I mean, once I removed some of the projects, I realized the significance of them in regard to fatiguing my brain. So I would say a specific project in particular definitely freed up my brain.
Yeah.
Um, uh, so that was good, I think, in just regard to maybe just stress load. But I think it was good overall to contribute just to my frontal lobe and stuff like that. So I would say more on the significant side than not.
Oh, fantastic. Okay.
Hmm.
Continue to eat on a carnivore style supplement MCT oil. Perfect. Exogenous ketones cause quite a bit of jabs. So that's okay. I mean, if you're eating carnivore, you're probably doing really good with that.
Hmm.
Um, I've added back more protein into my diet than I originally did in the beginning. Okay. How much protein do you think you're eating per day? Like how many grams of protein? Do you have any estimate?
Uh, I wish I had an estimate. I've never really tracked very well. Gosh, well, I have protein with every meal. Usually, I probably have 2 to 2.5 pounds of like
Yeah,
leanish protein. Yeah,
you're definitely getting enough protein.
yeah, yeah.
Yeah, okay. Uh,
Mhm.
so I had a bit more protein to my diet originally did at the beginning. I also found myself getting pretty fatigued when really working to push my ketones as much as possible, driving protein intake down lower normal cheap. Okay. So, but you did figure it out, right? You found the protein that dose that works for you. You're not worried about the ketones at this point.
Yes, yes, exactly.
And you don't actually have you measured yourself? Are you in ketosis on carnivore or not?
Not on carnivore, no. I mean, I guess it depends on like what would qualify. Like my ketones are zero point 0.4 typically
Ketosis.
on carnivore, and then when I really get, strategic and drop the protein down a little bit, then the ketones bump, but I just don't feel as good, if that
Yeah,
makes sense.
yeah, don't do that. Yeah, I mean,
Yeah.
listen to your body. You're doing what you need to do right now. Okay. I'm also taking some nutritional supplements and actually am now taking higher amounts of NAC and glutathione in my routine, which seems to be helping me with recovery and flare-ups mental endurance. That's fantastic. Okay. Okay. Which part of your are we not follow? I've not followed doing a lot of rounds, 3 to 5 days of fasting. That's okay. That's you did try it once though, right?
I tried it a handful of times, yeah, and I pulled it off a couple.
But just
I did a lot of 1 day fast because that seemed to be like, oh, I could barely get through the 1 day, but and in fact I'm fasting today as well.
okay.
But not a whole lot of 3 days. I haven't been able to do that.
Okay, that's okay. I would find that I totally fall apart during the fast. Okay, hands and feet getting extremely cold, vomiting, mass diarrhea. Yeah, that's definitely do not do the fast. I said 3 day fast. Okay, one. So being that said, I did a handful of 3 day fast, most rounds 1 day fast. Okay. And she mentioned that I stopped taking my thyroid medication as part of the past 4 weeks. I've gotten recent blood labs showing normal function without medication. I also spent the past 3 months still working with doctors to adjust dosage. So your TSH is back to normal?
Well, my TSH is around 5-ish. So I uploaded the labs, but yeah, I've been working with a telemedicine group called Paloma to try and really figure out the thyroid meds. And man, I've tried every possible combination. I've just felt so terrible on any dosage, any brand of thyroid medication. I don't know what it is.
Hmm.
But I guess I'd be considered subclinical hypothyroid. It's like 5.38, and then the T4 and T3 I think are low normal.
Yeah.
So
So you're in a tricky spot because you
I
want
know.
Sure. You know all this.
Yes.
Okay.
It's hard, man. I'm like, oh, I want it to work.
Yeah,
Ev
just trial and
yeah,
error. That's nothing you can do besides trial and error. Okay.
yeah.
Okay. Also, being off thyroid medication, notice the circulation problems that I had in my feet are no longer there. That's interesting.
Yeah. And I felt it's been a lot easier to fast as well. I don't know if that what mechanisms that could be, but
I mean, maybe just metabolic rate was just too fast. Like,
yeah. Hmm.
okay, that sounds good. Do you have any new persistent symptoms? No new symptoms. Extreme mental fatigue, mental fog, constant depression, consistent depression, extremely sensitive GI product. Okay, and then things that have symptoms that improved: poor sleep. You're getting better sleep since off the thyroid meds. Facial muscle tightness. Tell me about your facial muscle tightness.
So that would happen when my brain would get, kind of ultra fatigued. I'd find I would just my whole face would get tight. Not really a headache. It was just more like facial tension.
Yeah,
So that seemed to improve quite a bit, honestly, and I haven't really felt that
symmetric.
in a while.
Okay,
Yeah.
that was one of your like key symptoms you were getting like past your metabolic endurance of your brain, right?
Yeah, that was a bigger one, the facial tightness, and then the weird kind of brain vibration type of sensation. I haven't really had that in a while either, which is cool.
And do you think that's directly related to just not overdoing your frontal lobe
I
stimulus?
would, yeah, I mean, because basically the only time it would happen would be when I would sort of, my brain was sort of blown out, when I was kind of reached the threshold, that's when it would happen. And I haven't really hit that threshold lately.
Okay.
So yeah, I think there's probably a correlation if I had to guess. Yeah.
Yeah, and that's probably the thing to keep in your eye on forever. It's
Yeah.
my current concern still extreme levels of mental fatigue and depression as well as GI function, extremely sensitive, basically not deviate away from carnivore diet, have to be really selective and well supplements, as I very easily find myself with inflamed GI, really poor digestion and hemorrhoids. Okay. Um, you just might have to function on the carnivore diet for a while.
Yeah.
It's interesting the patient populations that I'm seeing respond to that has become more popular and people are trying it.
Hmm.
How effective it is for so many people. You know,
Yeah. Hmm.
I wouldn't be worried about it, and I've been
Okay.
a lot about it recently. It's like, yeah, it doesn't see. It seems to. I think certain gene types, certain microbiomes, it's like the only way to
Hmm.
get the system under control. I don't know why.
Yeah. Hmm.
Okay. Also concerned about progressing with neuroautoimmunity. I find having symptoms of MS when I have any flare-up types like increased mental muscle fatigue, muscle spasms, swallowing difficulty, subtle speed changes like slurring of words. Okay, so the key thing that you have to differentiate between what's fatigue and what could be like a white matter injury
Hmm.
is white matter injuries don't go away once you have rest. Okay, so like if you have a foot drop and all of a sudden you're flapping your foot and you've had plenty of sleep and you no longer have as much mental fatigue and you still have foot drop, that's white matter lesion.
Hmm.
Things like mental fatigue, muscle spasm, subtle speech, those are all like when your brain gets tired, they're all get harder to do. They're all
Hmm.
falling is motor, speech is motor, muscle contraction is motor. So your frontal lobe is all motor. So
Hmm.
frontal lobe is fatigued, and if you look at your brain region localization form, um, this is all the motor regions of the frontal lobe. So there's the cognitive, planning, organizing executive functions, which is the very tip, the orbital frontal. And as you go
Hmm.
back a little bit more, that's your motor strip. You have symptoms here involving injury in the motor strip. So motor strip includes swallowing,
Hmm.
speak, facial tone, muscle endurance, muscle energy. I wouldn't be too worried about those being MS.
Okay.
Now, if you get a symptom like your left side of your face has some kind of muscle tone change, that's different, right?
Okay. Hmm.
Spasm, but things like that. Your eyelid drops all of a sudden. The biggest things you'd be concerned with would be a very clear weakness pattern that's not resolving. Okay.
Hmm. Okay.
All of a sudden you can't feel your right thigh.
Hmm.
Those
Okay.
got some kind of lesion or injury. and then you would get like an updated MRI and see what's happening.
Hmm.
Your diet and lifestyle for autoimmunity is like impeccable. It's like
Okay.
there's not much left for you to do. Okay.
Yeah. Right. Right.
So and I think you're doing a pretty good job keeping everything in remission from any expressions of autoimmunity. I think it's just the injuries you've had.
Hmm.
Maybe they keep thing that's kind of holding you back
Yeah.
from total dominance. Okay. Vacation coming next week, steps to work out your symptoms. Okay. So there's a couple of things you should like really think about.
Mhm.
And it's like everything you've been doing like right now with your diet, nutrition, lifestyle, like I said, I think it's phenomenal for your autoimmunity. I think your all your autoimmunity patterns look like you're in remission, and it's just really when we look at your overall loss of function when I was looking through your file and reading everything and doing an exam and doing history with you, it was like Colin's brain is injured and he doesn't have endurance there. So how to
Hmm.
get that back? And then
Mhm.
biggest concern is like you're doing everything right. The only thing that can really shut you down is you may be overdoing it. That's one of the first things you got to figure out. So it seems like you've done a good job there. Okay.
Mhm.
There's only so many things supplements and lifestyle can do.
Hmm. Mhm.
Then you have to go like some next steps. This is where you start to cross into do you want to try peptides? Do you want to try hormones? Like for example, the problem is like for let's talk about testosterone for a second. So have you ever tried natural testosterone?
Uh, like injectable testosterone, anything like that? No, I haven't. No. Mm-mm.
So I'm not saying that's what you should do, but let me just kind of
Mhm.
things as options because
Mhm.
there's a point like how do we get your brain to start developing greater plasticity? And
Yeah.
by the way, you can never recover the brain if it's being exhausted all the time. Doesn't matter what you do.
Hmm.
Really.
Right.
So now, as
Hmm.
your something support your neuroplasticity, you'll be able to tolerate more stressors and things
Hmm.
that are more demanding for you. But um, so we're like your diet's perfect. You have protein, you have healthy fats in your diet, you have lots of nutraceuticals. You're good. You're not having
Hmm.
any triggers. You figured that all out. Okay.
Mhm.
So one of the things is like TRT. You're like 27 though. So it's
29.
29.
Mhm. Mhm.
29.
Yeah.
So the thing with testosterone has a very powerful anti-inflammatory effect on the brain,
Hmm.
but it supports mitochondrial biogenesis. It really supports synaptic connectivity.
Hmm.
Is a major brain booster.
Mhm.
And sometimes some people go on testosterone when their levels are really low, but sometimes people go on testosterone for recovery.
Hmm.
They get injuries and they severe burn injury or they have severe orthopedic surgery and they go on testosterone to recover to put them in an anabolic state. Okay.
Hmm.
So the problem is when you start taking testosterone, like you're going to lose some of your feedback loop, and there could be a possibility
Hmm.
once you're on it, like let's say at age 29, like you're going to have to stay on it.
Yeah.
Okay, but that might really help you recover.
Hmm.
So I mean, the safest way would be to use like natural testosterone therapy versus not like some of that synthetic stuff, and those are pretty commonly used now. Most people age 45 are being prescribed that just because of their age, even unrelated to their levels.
Hmm. Right.
They have neuroprotective and cardiovascular benefits. The risk factors are not really that high.
Mhm.
Major ones like really prostate cancer, very limited risk, but that's one of the things that could be supportive for you. Okay,
Hmm. That's interesting. Yeah.
start going in that direction. You might need some bigger boost. And have
Okay.
you ever heard of IV and AD therapy?
I have. I've never done it though.
Yeah, so this could be a game changer for you too.
Hmm.
And basically, it's compound that really supports brain mitochondrial function and recovery. And it's
Mhm.
intravenously. And most people that will benefit from it notice it right after the first session.
Oh, wow.
Do some repeated sessions and see how they do.
Okay.
That one is probably like the least invasive of them. It's
Mhm.
not testosterone. Even if testosterone, if you don't feel anything after like a month of taking it,
Mhm.
I don't want to do this. It's not like you're going to throw off your feedback loop for the rest of your life.
Yeah.
If you're on it for months and months and months, then your feedback loop could be changed in maybe even a year or two or something like that.
Hmm.
So you could even like you might have to consider trying some of these things. Okay.
Okay, definitely.
Another possibility would be ketamine. Have you ever heard of ketamine?
Yep, I have. Never tried it.
Okay, so this is like we can make a list in a second here,
Sure.
but more aggressive chronic depression.
Yeah.
Mechanism of it is really by increasing BDNF, brain-derived neurotransmitter.
Mm. Hmm.
It just jumpstarts the recovery um, from depression and even from brain injury.
Hmm.
Now, most research
Wow.
has been done in the acute stages, so yours really more in the chronic stage. We don't know
Hmm.
if that translates. So that's
Hmm.
another. And the other thing is peptides. That you heard of
Hmm.
peptides?
Yeah, never used them, but that's yeah.
Not the oral ones, but the injectable peptides.
Hmm.
So there's something called cerebrolysin, which is a peptide that helps with neuroplasticity.
Hmm.
I'll send you an email with all this stuff.
Oh, okay, perfect. I won't bother writing it.
Another peptide called sermorelin.
Hmm.
It's a natural peptide that just, as a secretagogue, helps your brain release growth to synthesize and release growth hormone. That's the
Hmm.
natural growth hormone that can really help with recovery. There's another
Wow.
peptide called BPC 157 that helps. It's a peptide your stomach normally releases to help with recovery. Like
Hmm.
those are all the things you can like look into.
Hmm.
If I was in your position,
Yeah.
then that'd be the
Hmm.
next level. The one that would probably be the one you're most concerned about because it could be addictive is ketamine.
Oh, wow. Okay.
But
Hmm.
like they don't let you. They give you one treatment with it and then see how you do.
Yeah.
You're done for like chronic depression.
Hmm.
So like the peptides are relatively safe. We don't. There's not a lot of, but there's like a tremendous amount of research behind them.
Hmm.
Everything's theoretical, but they're basically amino acids. They're
Hmm.
okay.
Ah.
Yeah, they're basic amino acids that are signaling agents that have an effect. So they let your body make its own hormones and growth factors that it's like that can help you in your recovery pattern.
Ah.
Those would be like
Ah.
pretty safe. IV and AD would be pretty safe. Testosterone, TRT could have a huge impact on you, but um, you might if it works for you and you're on it, you may need to be on it,
Hmm.
which that might be okay with you.
Yeah.
That might, there's some small associations with certain risks with TRT, but doesn't seem to be anything significant. So
Hmm.
that would be kind of a list of things I think for you to really think about. Now you
Hmm.
are. There's not much more for you to do with that nutrition lifestyle for brain automating. They're really
Right. Hmm.
and the biggest other factor is you figure out the relationship with things that were fatiguing you. You know how to recognize those symptoms. Now it's like how do you bump up your plasticity,
Hmm.
get you to the next level?
Yeah.
All the right things you've done. Like I think you're at the point where you may want to do some more aggressive approaches.
Hmm. Agreed. Okay, that makes sense.
Do you have any questions on any of this or this thought process or?
No, I think it's cool. I guess what do you think like order of business would be in regard to like of those handful of things? Like what would you personally approach first, do you think?
So I would put ketamine in the bottom of the list.
Okay. Hmm. Yeah.
Last option. Okay.
Okay.
And
Yeah.
then I would definitely, in your situation, I would not do them all at the same time.
Yeah. Right.
Okay.
Hmm.
And you're in Texas, right?
Texas. Yeah. Hmm.
Okay, so you have to find someone in Texas that can. I'm sure if you search, find them.
Oh, yeah. I'm
Or Texas,
sure.
Austin, or
So in the Dallas Fort Worth area.
Dallas, you have so many.
Yes. There's a ton. Yeah.
Well, clinic of
On
all
every corner for sure.
Starbucks and a peptide hormone clinic.
Yes. Yes.
So I mean, the peptides are going to be really low risk, no big.
Hmm.
If they work for you, you'll know within a week or two.
Hmm.
And they're just amino acids that are being injected in. That's all they are. They're not
Yeah.
hormones. I
Hmm.
think for myself, if I had to go like the least offensive to the body, I would
Hmm.
injectable peptides.
Okay.
Cerebrolysin, sermorelin, BPC 157. Those are the most common ones.
Hmm.
Working with peptide clinic, there's so many different ones too. They may make a cocktail for you, like
Oh, cool.
okay, but that might be
Hmm.
a big difference for you. And then I would say the next level would be the NAD therapy, IV NAD,
Oh, right. Yeah. Hmm.
and that's very very safe. We rarely hear anyone having any adverse reactions, and
Hmm.
uh, most people that have benefits notice it right away. That
Hmm.
that made a difference for me.
Yeah.
Point where um, so many treatments have like this effect, and then they stop having the same magic effect. Like you might have, let's say, a 50% effect at the first one, and then it might go
Hmm.
30, and then after you do 10, it's not that,
Papers off. Yeah.
but it's helping your brain recover potentially.
Hmm. Yeah.
Yeah. And
Hmm.
the problem is if this stuff is going to work for you,
Hmm.
may work for you, and you make it a fun false sense of great,
Right.
and then crash because you're, I feeling good. They do way too much.
Yeah, of course. And you go overboard. Yeah.
Sure it's gonna have, likely to happen, but that's okay.
Yeah. Hmm.
So then I would go peptides first, and IV and AD, and then I would consider natural testosterone therapy. Um,
Yeah. Okay.
Therapeutic age, even if your levels aren't totally low, but more for therapeutic reasons.
Hmm. And
And
what about the fertility piece? Like, is that kind of overblown when folks say if you get on testosterone therapy, it makes it difficult to
no,
conceive? Or okay.
no, as long as you have spermatogenesis, you're fine.
Hmm. Right. Yeah. Yeah. Okay. Cool.
Yeah.
Got it. That makes sense. Okay.
So testosterone impact your LH pathway, but it's not going to impact your FSH spermatogenesis pathway. So
Hmm.
there shouldn't be any impact with it at all.
Okay. Cool.
Okay, so that's what I think you should look into. Okay,
Hmm. Hmm.
if they want to like read up on it, cost benefit to you, and then I'll send you an email, kind of just summarizing it in order, like we talked about, some of these things, and then keep me in touch with what you decide to do,
Hmm.
and ultimately, let's say in the next few months, you up to trying some of these things?
Oh, dude, definitely. 100%. Yes.
So then you
Yes.
can like go, hey, I want to try this therapy for the first month. Don't do them all at once.
Hmm.
Break it with that, and then start this one and start this one.
Hmm.
See where you are. And then if you like you get no results with any of this stuff, then shit, try ketamine.
Yeah. Hey, I mean, that's like worst case, right? So, I guess for your recommendations in regard to like, let's say peptides, I guess NAD therapy, there's lots of IV clinics, so I could always go that route. But for the peptides and possibly testosterone, I mean, there's so many anti-aging clinics. Are there ones that you would say, hey, totally like disregard these, or because there's so many? I don't, you know.
Well, like for example, testosterone, if you're gonna do natural testosterone
Hmm.
therapy, right?
Hmm.
It's pretty a standard dose, to lowest dose possible. Kind of go from,
Hmm. Yeah.
you're not gonna overdose you and do anything. And there's not much to choose from. It's bioidentical testosterone. So it's not,
Mm, right.
and then with
Hmm.
peptides, it's pretty standard too. There's like so many units you take for each one when you first start that have been
Hmm.
standardized. I don't think you can have. I think you just have to find the place that does them, and it's pretty standardized
Okay. Yeah.
places.
Mhm.
Anything you have questions or concerns about?
No, that's it. It's we just had our first son, so the whole sleep thing I'm trying to work, the best I can with that because he's 5 weeks old right now. So
Like for sure, sermorelin is a peptide that puts people in really deep sleep.
oh, awesome. Hmm.
But yeah, experiment. Like you could have a completely unique, different reaction to some of these things.
That's true. Yeah.
If you do peptides, you definitely want to start with one at a time.
Hmm.
See where you are.
Test to meet. Yeah.
You might want to try sermorelin, but if you work with a person who's working with peptides all the time, which is not me, but like that's their
Yeah.
field, they might have their own like, hey, this is how we do it. This is our experience, and then go with them because
Hmm.
they're more qualified. They are experienced with it, and I'm not. I just
Sure.
experiencing patients on some of these things, and
Hmm.
I think it'd be the next step for you.
I love it. Okay, cool. So yeah, I'll just one by one kind of knock them out and keep you posted. Do you want me to do weekly updates or monthly updates or anything like that? Or
You try something new. Keep me in
Mhm.
the
Okay.
at any time like you feel like you need to talk.
Mhm.
Yeah, I definitely want to talk to you in the next quarter.
Okay. Yeah, for sure.
Let's connect for sure. But
Hmm.
just so I can keep it in your file too, and then before each talk, I get it. compromise of what emails and all the stuff, and then I get to kind of look at everything before. So,
Okay.
and then with the fasting, kind of just do it when you feel like it, if you even want to. You may not even
Mhm.
like fasting as you're experimenting with each of these things.
Mhm. Ah, true.
Then if you start to get now, ultimately, if you get once, let's say that some of these things work for you,
Mhm.
changes your function, you have some better recovery. We still want you to get into fasting and autophagy and all that stuff down the road.
Hmm.
If your bioenergetics are still compromised,
Yeah.
you may need a boost.
Hmm. I love it. I think this is a pretty cool strategy. Honestly, I've not thought much about any of this stuff, so I'm excited, man. Just one by one, I'll
Yeah.
start hitting
Well,
them and see what
I'll get the
happens.
list like just what we talked about, and
Mhm.
you know, and then
Sweet.
we'll go from there.
Awesome. Thank you, Dr. K. Appreciate you, man.
Yeah, congratulations, by the way. Here,
Yeah,
talk.
thank you. Thank you so much.